And joining us now is CBN News medical reporter Lorie Johnson. Lorie, always great to have you on the show. Now, despite the increases in cases, the death rate is dramatically down. Do health experts expect the death rate to increase on the heels of all these new cases?
Well, you know, John, it is a possibility. Dr. Anthony Fauci was testifying in a congressional hearing yesterday, and he's expressed some concern about that because here's what we know. Usually when we see a spike in positive cases, 2 weeks later, we often see an increase in hospitalizations. 4 weeks later is when we see a jump in deaths. The only difference, though, John, and this is really important, is that the number of new cases are predominantly young people. It's very surprising. We're talking about people in their 20s, 30s, under age 45. The median age, for example, in some of these hotspots, for example, in Florida, is 37 years old. And we know that most people who die from COVID-19 are older, particularly over age 80. So it'll be very interesting to see what happens to these people who are driving these positive cases up. They're predominantly young people. We worry, of course, and this has been the worry since day one, that young people who tend to be asymptomatic and do just fine don't even have to be hospitalized in general. We worry about them passing it along to their older relatives and to other people with whom they interact. And that's where masks come in. And there's this strange controversy about masks. It's gotten political. We're 18 weeks away from a presidential election, so everything is political these days. And for some reason, masks have become political. But the research is clear and overwhelming. Masks prevent transmission by 50%. So the overwhelming message is if you go out and you can't social distance, wear a mask.
Whenever I'm not in the studio, I am trying to wear a mask. You had mentioned hotspots. There's some good news in the fact that some previous hotspots, like in New York, New Jersey, and Connecticut, they're reporting much lower rates of infection and actually discouraging travel into those places from current hotspots. Can you explain what's happening there?
Around is fair play. It's the absolute opposite of what was happening before. For example, Governor Cuomo said people who are coming to New York from hotspots like Florida, Texas, Arizona, North and South Carolina need to self-quarantine for 2 weeks. This is exactly what we saw many weeks ago in Florida, where Governor DeSantis said people coming to Florida from New York need to self-quarantine for a couple of weeks. You know, New York, New Jersey, Connecticut, they've done a great job bringing down their number of cases, number of deaths, and they want to keep it that way.
Understandable. Now, a new model predicts the number of deaths in the United States will reach 180,000 by October 1st. But there's a catch. What is that catch, Lorie?
And this is a brand new model by one of these very reputable agencies, the University of Washington, and we've been relying on their models since the very beginning. And they said, yes, 188,000 deaths by October 1st. But they said if people wear masks in public, then that number will be reduced by 33,000. So if people are good about wearing masks, they're talking about 147,000 deaths by October 1st. Right now, we're at about 122,000 deaths. So we're talking about 25,000 more deaths between now and October 1st is what the prediction is. Although, John, as we've seen, these models can sometimes be way off. And oftentimes, what ends up happening is better than what they predicted. It all depends on our behavior.
Well, that is indeed the hope, better than predicted. Lorie Johnson, CBN medical reporter, thank you so much for your time.
My pleasure. Thanks for having me.